or smanutrition.ie. Proudly sponsors Temple Street Children's Hospital.
Located in the heart of Dublin's North Inner City, one place has provided acute paediatric care for almost 140 years. A home from home which offers safety at times of uncertainty. This building tells a story of hope, determination and strength. And tonight, we go behind its doors to share the stories from the theatres and wards, to meet the staff who dedicate their lives to the care of Ireland's children, and to follow the journey of families and their little patients who are in need of vital and life-saving treatment. Welcome to Temple Street Children's Hospital. Monday morning at Temple Street. In the intensive care unit, a young baby named Jack has been transferred from accident and emergency for further investigation.
We had him in 3 weeks ago with bronchiolitis. He was kept in for a week. 2 weeks ago we got out. Then yesterday he was very sick. He was grand yesterday morning, and he started getting sick then about 2 o'clock. So he was very sick. He was brought straight into a resus.
They're giving him loads of different things, so and he just says then they were treating him for meningitis.
The top of his head was fairly swollen, so the doctor last night told us that he might have an infection in and around his head, so they gave him antibiotics, done a scan of his head as well, everything was grand, so he's been doing all right, so we're just waiting. He says this afternoon the results of the blood tests will come in, so just waiting to hear back on that.
Jack came in during the night at about 1 o'clock this morning, and he's nearly 5 months old, and he just came in with very high-pitched cry and seemed to be very irritable. When he came into casualty then, he would have been assessed, and basically they're treating him for acquired meningitis, is the picture it looks like at the moment. There are two types of a meningitis. There's a bacterial and a viral. Bacterial you treat usually with antibiotics. A viral is like any sort of a virus that you get. And basically we all carry that in our nose, and you might never get meningitis. Sometimes then babies in particular, because they're smaller. And Jack had been a little bit ill a few weeks ago. He had a bronchiolitis, which is kind of like a respiratory infection. So his immune system was a little bit low, and that may be one of the reasons why he got sick now. It's an infection in your brain. It's where there's irritability in your brain, and you can have different forms of meningitis. Some can have a rash, which is with the bacterial, and others then don't. There isn't a rash present. Particularly with the bacterial meningitis, that can spread rapidly. There are a huge amount of follow-on kind of disabilities and neurological deficits that you can have from meningitis if it's not treated early.
I know how serious, like last night I was told it was real serious, like and stuff like that, so I know how serious and sick he is.
When he did open his eyes yesterday, he was just sort of looking out the side. He wouldn't look at anybody. He was just sort of looking past you, you know. So scary few hours.
Is it a new one?
No, it's
the next level.
The next level? No, it's the new course.
Oh, new course, excuse me.
Over in the day ward, Andrew has arrived at the hospital ahead of surgery. Today in theatre, he will receive a series of Botox injections to help with his mobility.
He's here today to get casts on his 2 legs because he walks on his toes. And
I got them in junior infants.
We had the same procedure done about 2 years ago. And the fact that he's grown so much now, he needs to have it done again. When he started to walk, he was falling over a lot, and he was constantly up on his toes.
You know, we'd have to help him up and down steps and stairs and stuff like that. So the warning signs were there, but as he started to grow, the more he went up on his toes, and then we had to get it diagnosed then that it was a mild form of cerebral palsy, diplegia, and that as he was growing, the condition would get worse because his muscles weren't stretching. So this Botox helps the muscle to stretch as he grows, but he has to be put in cast every now and then so that his bones and his muscles grow together.
He loves everything, like he loves soccer and football, and don't you, Andrew? Yeah. But like he hasn't them on today. He does wear splints on his legs normally, or his foot goes into them and they're tie around, so he wears those and they keep him down as well. But just we need the cast on to work on him better as well.
Yeah, as he grows, we're basically playing catch up, trying to keep up with it because his muscles and bones aren't developing at the same rate, and this is one way of keeping his feet on the ground.
Staff nurse Denise Traynor will accompany Andrew to theatre.
He is what we call a toe walker, in that he walks with his toes down and his heels up. For him, I suppose in a certain way, he has been used to it.
Yeah, okay.
But as he develops, it would cause him problems with balance. His treatment today is that he will be taken to theatre, Botox injected, and this is to release the pull on those muscles.
It's just that every time he grows, he gets a spurt to grow. He's after growing, what, 1.5 inches there?
His legs have grown 1.5 inches in the last few months. Is that right, Andrew?
Yeah. Okay.
Yeah, that's why all his trousers are too short for him. Isn't it?
You know the way they have to wear a mask?
Yes.
You're going to get one of those masks.
Oh.
Do you remember it from the last time?
No.
Probably not, no.
No, 2 years ago.
Yeah, that's right. And what happens is there's a smelly gas in it. But there's a trick to it, all right? What you do is you breathe in through your mouth and not through your nose, and then it's off. And then you fall off the seat. And then we fix your casts. Isn't that the plan? It is, my friend.
Now, what do you first this? Put them here. My ball of fluff, how are you, sweetheart?
Meanwhile, in the St. Michael's ward, two familiar faces have arrived at the clinic. Sophie from Sligo and Michaela from Mayo both attend the hospital on a regular basis.
Michaela's 6 years old. She was diagnosed when I was 18 weeks pregnant. They knew then that her kidneys were polycystic, so initially they had said she probably wouldn't make it at all. She was sick an awful lot. She'd come home for a week maybe, and she'd be up again to Dublin for 2 weeks, and she'd be home for a day, and she'd be back up again sick the whole time.
Sophie, she was diagnosed in 2009. She was about a year and a half, and then she just got sick over a week or so.
Hey, pig.
We're going to Temple Street now for almost the past 5 years for dialysis. She realises her kidneys aren't working. She's always saying, when I get my new kidney, I'll be able to do this.
Then she diagnosed that she had Wilms tumour in her 2 kidneys. She was got very early.
My fingers
It was brutal. It just was blowing to the face. You just couldn't comprehend. You can't understand how anyone so small or so young could actually have cancer.
Before she was born, we got no hope, that she'd survive or that. But she's been great. Like, she's been through a lot, and she seems to be strong and a great little fighter. Like,
she had 6 operations in the first 3 months of being in Crumlin. So she went through the mill that time, but she's come back now, and all her hair is back and everything. So she's delighted with that. Aren't you? You love your hair, don't you?
Both girls require regular dialysis treatment 3 times a week to remove toxins and excess fluid from their bodies.
This is the only centre we have for children, purely because where we have all the experts here, and it's such a small number of patients on haemodialysis for children in the country in comparison to adults. But for that, though, it means that the majority of patients are travelling long distances, and that can be gruelling.
High five. Yeah.
Outside the intensive care unit, Jack's parents wait for news. whilst the medical team examine him further.
He has had tests done last night that he will have a lumbar puncture done, and that's where they take some CSF, which is the fluid around your brain, and that goes down along your spinal column, and we take it from the spine. Again, it's a definitive test again for meningitis, and it's part of checking the type of bug there is. And we'll be looking at his temperature and his blood pressure and his heart rate and his colour, and all of that is part of your assessment, really.
3 bottles to fill out of his back.
So did you start to today because it's 2%
Oh, so wouldn't have stayed in there anyway. The worst feeling anyone would want to go through seeing that child like that.
Especially only after being here like 2 weeks ago.
It's not nice at all.
The samples from the lumbar puncture are taken to the laboratory and examined alongside the other blood specimens.
Meningitis is one situation in a children's hospital where you definitely have to shoot first and ask questions later because it is such a potentially serious disease. So in Jack's case, he was started on the appropriate antibiotics, and then samples were taken, a blood sample and a sample of spinal fluid, which is sent to the laboratory. And what we do in the laboratory is to try and determine, well, is this meningitis? And if so, what's causing it? So, for example, we look for the presence of white blood cells in the spinal fluid, which indicates that there's some sort of inflammation or perhaps infection going on there. We also try to grow the bacteria from the spinal fluid to see if they're causing the meningitis, where we're able to use a test called PCR. This is what's known as a molecular test that allows us to detect very, very small amounts of the DNA from the bacteria that cause meningitis, either in blood samples or in spinal fluid samples. And what this means is that we can actually make a diagnosis of meningitis in a matter of hours, where traditionally these sort of tests would take a couple of days.
He's still under close observation, really, basically. He is still quite irritable and crying, quite a high-pitched cry, but he does settle at times, and he was smiling a little bit. So there are all the things you're looking at, and you would hope that that wouldn't change at the moment. But, of course, you don't know that, really.
Hi, I have the CSF results on Jack Robinson. His white cell count is 7,680. His red cell count is 111.
Toddler Know-How, SMAnutrition.ie, sponsors Temple Street Children's Hospital.
This Monday, come